Friends, welcome to this session on handling aggressive patient party. The whole idea of this session is to prepare the participants to, first of all, identify what leads to aggressive reaction, how that can be mitigated, and in case if you can notice the aggressive behavior among patients or their family members, then how do you really de-escalate the situation? How do you really identify and de-escalate this situation? That's the whole idea of this session. So let me take you through the presentation simultaneously and discuss what exactly we are going to cover in today's session. Okay, so we all know that patients get angry, their family members get angry, but then it's very important. Yeah. Can I request you to put your, can I request you to put your mobile device on the mute mode? Everyone, please. Okay. So as I said, there are always reasons why people get angry, although that's not something that is acceptable. But at the same time, it is very helpful to know why people get angry. And if we can manage that, then definitely we can at least prevent those situations that normally causes anger. And then also make sure that if we can see something like this happening, how do we go about managing that situation? It's helpful to understand why people get angry. So this article by Mark Gorkin is very helpful to understand why people get angry. So according to Mark Gorkin, the four phases of the anger starts from four eyes. So whenever somebody has a palpable sense of injustice, injury, invasion, and intention, there is all possibility of having an aggressive reaction coming from the person. So let's understand each point carefully. For example, when we talk about injustice, whenever patients or their attendants will see themselves as victim of any injustice, unfair or disloyalty, they are likely to get angry. And a lot of studies have shown that sometimes knowingly or unknowingly, we have a tendency to be unfair to the patient. For example, if we look at this study, this is in Europe, in one of the country, it says it is actually a self-reported study where the staff said that patients, especially the elderly patients, when they are institutionalized, 64% of the patients actually suffer elder abuse. Psychological abuse is around 33%, physical abuse is almost 14%, and the neglect is 11.1% or 6%, and almost 2% of the patients also experience sexual abuse. And actually, female patients and patients with cognitive impairment and patients older than 74 are at a higher risk of abuse. This is another study in India, in Uttar Pradesh, where 57% of the women patients have reported mistreatment during childbirth. Almost every woman goes through some level of disrespect and abuse during childbirth, especially in states like Bihar in India, where over 70% of the women give birth in hospital, and almost all of them experience some level of disrespect and abuse during childbirth. And this is not a problem of only developing countries. Developed countries like New Zealand, US, Australia, and UK, they identified 6 types of mistreatment. The most frequent of which was failure to meet professional standards of care, then specifically being neglected and abandoned by the healthcare providers. The second angry eye is injury. So whenever patients experience injury at our hand or they are harmed at our hand, they feel they're likely to become angry and aggressive with us. So when they feel being disrespected, discarded, or ignored, so it may not be a physical injury to them, but definitely it is an emotional and psychological injury to their mental health. And there is a sense of insult and humiliation along with the injury. Again, if you will look at the global picture, according to WHO, every 1 in 10 patients experience harm while receiving hospital care. 10 out of 100 patients acquire infection from the hospital, infection that they did not come with. Half of the harm is attributed to medication. And I'm sure you also must have seen a lot of medication error happening in patient care. Approximately 12.7 adverse events happen for every 100 hospitalization. Patient fall rate is 3 to 5 per 1,000 bed days, and more than one third result in injury to the patient. 5.7 to 8.4 million deaths due to suboptimal quality care. More than 50% of the harm is preventable. I think this global picture should open our eyes to the idea how much harm patients experience at our hand. The third angry eye is invasion, where patients feel intruded by us and they feel their personal space is constricted, disrupted, or violated. So when we enter the patient's room without knocking, we expose the patient, we start examining the patient in the OPD, and we don't care who all are standing there or watching. That clearly kind of gives them a feeling that their physical, care is not being done in a very respectful manner. So when their identity and bodily or psychological integrity are threatened or attacked, again, there's all possibility of them getting angry. So again, as I said, during childbirth, most of the mothers feel that they were not given a very disrespectful attention or care, and they were left exposed and they were lying on the labor tables or in the labor room without even properly being covered. So this is one study in India where it's in public hospital. This study found that patients actually reported feeling violated when their personal space was invaded, to the extent that they were examined even without informing or without their consent. So lack of privacy during childbirth is, of course, another common problem I'm sure you also must be seeing in your place. This is another study by Chakravarti, where psychiatric patients, they have reported that they didn't feel, being looked after with privacy and confidentiality. When there were people moving around them and they were being asked, questions, those were sensitive or those were, uncomfortable to answer in the presence of others. But then patients do experience that they are asked such uncomfortable questions and they have to answer them. So when all these three or any one of the three eyes are present, then there is an injury or there is an invasion or there is a injustice, there is always a possibility of the last eye, and that is intention. That means when there is energy and determination to do something about what they have gone through. So that means they decide to challenge the status quo. That's where they decide that we want to really give them back. The violence that we experience is usually when they are fed up with our behavior, with our insensitivity, or with our rudeness or aggressiveness with them. So I think it's very important to remember that there are situations where there is a more possibility of having an aggressive reaction from the patient party. Actually, I always say, like we have learned medical triaging, we should learn social triaging. So there are certain situations where there's a possibility of having more possibility of having an aggressive reaction than usual. For example, medical conditions where the patient is suffering with dementia, delirium, traumatic brain injury, and neurological condition, there is more possibility of having an aggressive reaction from the patient party. For example, if the patient is confused or there is some cognitive impairment and they are not in their senses, or those who are under influence of drug, again, patient becoming aggressive is more likely. Pain or discomfort can definitely trigger aggressive reaction from the patient and patient's family as well. Fear or anxiety, for example, if the patient or the family is fearing some serious diagnosis or poor prognosis or some complication, again out of fear, out of anxiety, they may overreact to the situation and become aggressive with healthcare providers. Even frustration, for example, when they have to wait for very long without proper explanation, or there is lack of information, they are looking for an update, they want to know what is patient's condition, what is the possibility of recovering, what is the complication. But when we don't provide those that information proactively, there's a possibility that they can react in a more aggressive manner. And whenever patient or their family experience feeling of helplessness, that they can't do anything to change the situation. For example, if they can see death is inevitable, or the health is not going to recover, the patient is not going to recover, so family especially feels helpless in that situation. So out of anger, there's a possibility that they may become aggressive with us. So if we understand the stages of how from simple anger to aggressive reaction, how the things change, I think we will be able to mitigate this situation at the earliest possible. So let me explain you the stages of crisis development and how do we go about managing those stages. So as I said, that crisis movements do not happen all of a sudden. There are always warning signs that provide us an opportunity to intervene before the crisis occurs. So it's always good to control the situation at the earliest, so that it's more manageable at that point of time. So it is better to mitigate the situation at the earliest. So some of the red flags that I'm sure you must have seen, and that is called crisis stage one, or we call it triggering stage. That means the problem has just started to begin. For example, you may see the patient or their family may show signs of increased tension, irritability, or frustration. Trigger could be pain, fear, unmet needs, or perceived neglect. So there is a possibility that in this situation, there is a possibility of patient or the family becoming frustrated and angry. So you will see they will speak in louder than normal voice. They may be pacing up and down. They will even try to talk to different people, asking questions, clarifying, because they are not clear about what is happening, what is likely to happen, why is this happening. So as a result, they are now actually becoming aggressive. Now at this stage, the management strategy that will help us is early intervention. So as soon as you or your team members who can see that the patient or their family members are becoming kind of frustrated or disrespect, restless. Restless, that means that there is something that is bothering them. So it's very important to actually address that at the earliest. So it's important to not only, address their concern, it's important to even offer reassurance and also see what you can do. So best would be to make them sit and talk, because when you give them a safe place to sit and express, they are likely to calm down. If you ask them what their concerns are, they feel being heard. And then when you offer them a glass of water, or you tell them that I'm there to help you and I'm here to help you. So it's important to actually communicate who you are. How are you going to help? So they may not know who is doctor, who is nurse, who is the attendant. So it's good to tell I'm doctor so and so, and I'm here to listen to your problem. Let me know what is the problem and I'll try to help you. So you identify yourself, your role, and how you're going to help them. Explain the process and procedure in simple terms, that I will try to understand your problem. If it is something that I can do, I will do it. Otherwise, I'll definitely escalate your problem to the higher up, and I will seek their opinion, and I'll try my best to resolve the issue. When you can see that they are upset or they are very disturbed, it's helpful to acknowledge their state of mind and feelings. When you say that I can see you're very upset, I can see you're very angry, I can see you're very fearful. So when you acknowledge their emotions, even that kind of expresses empathy and calms them down. And then you be from your experience, I'm sure you would know what kind of questions or requests they may come up with. Be ready with solutions to help them. Now, once they start sharing their problem, it's very important to listen to their problem carefully and attentively. Half the suffering diffuses with someone listening attentively. And then, whatever information you have, whatever clear communication you have, explain it to them. Tell them how you're going to help them, what you're going to do, how you're going to address their concerns. So when you give them that information, not only that they feel reassured, but they also get clarity on what you are going to do. When you're talking to them, a lot of things they may say, but you actually have to understand from where is this coming. It could be fear of death. It could be fear of complication. It could be something that they're not able to spell out clearly, but it could be something that is underlying and that is disturbing them. So, in between, when you observe them, you stay silent and you restate whatever they have said, you get a clarity on what exactly is bothering them. While they are sharing their concern, it's very helpful to stay calm, because if you try to give this reaction, oh, it's a small thing, why are you making a big issue out of it? So we may not say that verbally, but what happens, that comes into our body language. So we have to be very careful about our demeanor. Don't interrupt when they are speaking. Let them complete what they are saying. One, because if you listen to them attentively, they feel being heard. Second, they may have something important to share, and when you don't interrupt and you listen to them, you get complete information from them. And then at the same time, I think interrupting upsets the person. They feel, uh, I'm not being allowed to express myself. So it's very important to stay calm and listen to their concern without interrupting. Even if, for example, what they are saying is not correct, you can clarify that once they have finished speaking. In between, don't try to correct them by saying, no, 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 what you're saying is not correct. This is not what happened. This is not exactly the situation. So when you try doing that, it neither helps you nor it helps the other party. So maybe you can note down that point. Once they have completed, you can later on tell them that you mentioned this, that this is what you thought or felt. And then when you explain to them, this is misinterpretation of the situation. This is not exactly what happened. So if you don't try to be in hurry to justify yourself or correct them and allow them to complete what they are saying, they feel that, okay, my concern has been heard properly. And then whatever small concern also, when they share, don't shun that away. For example, if a patient's attendant comes and says, my wife was lying uncovered, she was not even covered properly. So maybe working in gynae, for us, it may not be a big issue. We might think, oh, that's very common. But maybe for the family member, that's a very big concern. So don't say that it's a small issue and you're making a big issue out of a small thing. When they're expressing themselves, use empathy. So when you be empathetic, you're able to see what they are feeling or thinking. So put yourself in their place and think, if it was my family member, or it was my child, or it was my other family member, so how will they feel? So don't judge or discount their feelings. Saying that, uh, if you will judge them for their feelings, you will feel, oh, they are making a big issue out of nothing. But actually, when you are in a situation, every small discomfort is a pain. Every small problem is a it's big for them in that moment. So please don't try to judge them or discount their feeling, and rather be empathetic and see what they are going through and how you can relieve their suffering or minimize their suffering. So, even if you think their feelings are not justified, but we have to remember, when they are unwell, they might overreact to any situation, and that's how the human mind functions in those situations. It's best to acknowledge them. It does not mean that you accept their anger or you say, it's okay to be angry. No, that's not the thing I'm saying here. But if you say that, yes, I can see you're very upset, and I can understand that this is really a situation where people can get angry. But don't worry, you're not alone into it. We are there to help you. We'll try to help you. So when you express empathy by acknowledging their feeling, recognizing their feeling, normalizing it, and generalizing it, they feel being heard and kind of accepted. Then the next step is when you can see that they have actually suffered for some reason. Sometimes, for example, a poor prognosis is something that you have not caused, but they are going through inconvenience, pain, suffering. So, apology in such moments play a very big role. So, when you apologize, not that you are responsible for their suffering, but that's actually an apology for the inconvenience they are going through. So, actually, apology has two meanings. One is it is an expression of compassion, that is, I'm sorry that you're going through this. I'm sorry this has happened to you. And the other is expression of responsibility, where you feel that yes, an error has happened by us or by any team member. For example, if we made them wait and we did not inform them that the doctor is not available or the doctor will come after 2 hours, then I think somewhere it is our mistake. So we have to take responsibility of that error and making the patient wait. So when you take that responsibility, one is they feel that yes, you are realizing you have wasted their time. And we have to express, empathy at that, oh, sorry, apology at that moment. So, but usually just saying sorry, I'm sorry what you're going through is more like an expression of compassion. So a lot of time when we offer apology, but that's not apology in true sense. For example, when you say, if what you're saying is true, then I think we are sorry for it. That means I don't really trust you. I don't think what you're saying is truth. It is half truth. Or when you say there was a mistake, but it was not caused deliberately. Again, you are giving an excuse for what you have done. That's not a good way of offering apology. I'm sorry, we can't attend to individual request. That's more like you're just, saying sorry for the sake of saying sorry, but you are not trying to help them. I am sorry, but we do not allow visitors during non-visiting hours. If somebody is requesting with a genuine reason that I know it's non-visiting hour, but I need to see my patient, I think we need to see how we can accommodate their help, their request. But instead we say, I'm sorry, we don't allow visitors during non-visiting hours is again of not much help. Now sometimes these things happen. Again, this is no apology. This is something like, oh, there was a lot of workload, or the staff was very exhausted, staff was very busy, or the OPD was very heavy. I'm sorry that happened to you. I'm sorry, you can't give all these excuses and say sorry. So such apology do not have much meaning in the real sense. So when you have apologized genuinely, it's time to actually see what they want. It's very important to see how you can find a relief or solution to the patient. Ask what do they want. A lot of time you may provide them 10 options. I can do this for you. The doctor is not available. The other doctor will see you. I can help you in this way. But it's best to ask them, what do you want? How can I help you? So what sometimes what they want is also not a very big thing which you can comfortably do, and you can resolve the issue. And when they say that this is what can help, for example, a patient has come for MRI and your machine has gone defunct. So the patient's family has come from a very far off place, and you are saying, sorry, the machine is out of order and the engineer is yet not here, and we don't know when the machine will be okay. But they say that, ma'am, I understand your machine is out of order, but I have come from almost like 200 kilometers. Can you help me in some way? So that means now you have to start thinking, how can I help this patient? Because this patient hasn't come from a nearby place. They can come, go home and come back tomorrow. So you sincerely try to resolve the issue and address their concern. At that moment, even if they speak little loudly, please do not focus on their behavior. Focus on the solution. That's because I know when the other person speaks in an aggressive way, we are likely to mirror their behavior. Be mindful, don't copy their behavior, don't even focus on their behavior. Focus on how you can resolve the issue and avoid being defensive. So when I say while exploring issues, try to find alternatives with an open mind. So there's an activity I normally give. I'm not sure if you would like to do this activity. I want you to put these 9 dots in your notebook in case if you are holding a copy and a pen with you. Are you having a copy and a pen?
Yes,
Yes,
madam.
miss.
Okay, great.
Yes, miss.
So put these 9 dots in
Oh,
your.
yes, miss.
Can I request you to put your device on mute mode? Okay, so draw these 9 dots in your notebook and try to connect these 9 dots with 4 straight lines without lifting your pen. I repeat the instructions. Connect all 9 dots with 4 straight lines without lifting your pen.
Without lifting our pin.
That's right. Yeah. Is it possible? Is it
No,
possible? No, not possible.
I couldn't. I'm trying.
Is it possible?
I'm trying.
Look at
I
this.
think no.
Look at this.
I'm trying.
Look at the screen. Is it possible? It is possible.
Can
Only
I?
thing
Can I?
we need to go out of the
Yeah,
box.
it is possible. It is possible.
Yes. Look at the
It
next
is possible.
slide. Even this picture shows all 9 dots.
Yeah, it is also possible.
Yes. You could also connect all 9 dots with 3 straight lines.
Mm.
The idea is we have to go out of the box to find the solution. That's the whole idea of this activity. Initially, it might appear impossible. Initially, it might appear it's not possible. So when patients and their family members come with some request or some complaint, and you think what they're asking it's not possible, that means you're already putting a full stop. No, I'm sorry, I can't help you. Naturally, they're going to get annoyed. So you have to really go out of the box and find what is the way to send this patient satisfied. Actually, this is the first stage where you can stop and control and de-escalate and mitigate the situation, provided you start thinking creatively to find solution. If you are not able to stop at this stage, you will see the problem will escalate. And this is crisis stage 2, which is escalation stage. So if you look at the picture, it clearly shows now emotions are taking over logic. You will see increased emotionality, signs of anger, shouting, or threatening language. The body language also will become aggressive. The person may begin challenging you or the authority you represent and become belligerent. That shows that now they are getting upset and they are also losing their composure. They are likely to now start misbehaving initially verbally, and there's a possibility of aggressive reaction later. So you can see them speaking loudly, arguing with their security staff, technicians, nursing staff, expression of dissatisfaction, expression of disagreement, refusal to cooperate, refusal to even pay. Suppose if you ask them, okay, go and make the payment, and they say, no, first you do what I'm asking you to do, I will pay later. That is now they are slowly becoming, aggressive. So at this stage, the management strategy would be, first of all, maintain composure. Don't get angry or aggressive. Usually, when patients misbehave, we also lose our composure and we also start speaking loudly. But very mindfully, we have to stay calm, use a low or a steady voice, avoid arguing or challenging the patient, and avoid using confrontational language. Because the moment you will use this, things will go out of control. At that moment, you have to calmly provide them guidance. For example, you tell them, see, I want to help you, but you need to calm down. Sit down, explain me your problem. I want to help you. I'm trying to help you. Let me see how I can resolve the issue. So that means you are asking them to calm down and give you an opportunity to solve the problem. At the same time, you can set boundaries. You can say, if you shout like this, then probably I will not be able to help you. I will have to, send you to the next person who can help you. So that means you are setting boundaries where you are telling them that this behavior is not acceptable. You can also give them direction in case if you are not able to help or find solution. You can ask them to go and meet your, for example, if you have a system where there is a patient relation officer or grievance officer or some complaint office, you can ask them to go and meet that person and express their anger in the right manner, maybe writing a complaint or writing a feedback or speak to the concerned person who can resolve their issue. That's only if they are not ready to cooperate with you and listen to you. And the third point here would be assert. When I say assert, sorry, it's a fourth point. Assert, that means clearly spell out what you can do and what they should do. So whatever you can do, you can say, I'm ready to help you in this way. This is something that I can do for you, but this is something beyond my power. So clearly spell out what is doable and what is not doable, and also tell them what are they expected to be done. So if they act aggressive, if they misbehave, then you will not be able to help them. But you don't have to become aggressive. Be firm, but not aggressive. So at the same time, when you can see that this person is now becoming aggressive and there is a possibility of violence, so the management strategy at that point will be engage support. So discreetly, you can alert your colleagues or your security personnel for backup, if needed. See what happens if you call the security personnel and they are in their visual field, if they can see them, there's a possibility that itself can trigger anger and aggressive reaction. So ask the security personnel to be around but not be in their visual field. So couple of points we should keep in mind when we are handling that situation. One is be aware of your body position. Don't stand very close to them, because if you go and stand close to them, it is kind of that I'm challenging you, or I can control you, or I can hit you, or I can. It may not be done by you. It could be your security personnel who might do it, but that's something not desirable because this can be counterproductive. When you will invade their space, they might act out of anxiety. They may start even hitting you back or your team members. So safe distance of 3 feet is reasonable, because then there's a safety distance. Also, it's always preferable to have a table in between you and the other member. And then in the counseling room or wherever you are talking to them, it's best to have two doors, so that if you feel unsafe, you can actually go exit the place using the door behind you. Because if there's only one door, and usually the family or the attendant is closer to the gate, the moment you will try to go out, there's a possibility they might catch hold of you, or they may think that you're trying to run away, and they may start physically hitting the person who is trying to exit. So I mean, I normally advise in the counseling room one should have two doors. Then when they are unhappy or dissatisfied, there is a possibility that they will try to argue with you. They will say something just to trigger you. Don't argue. Avoid answering every statement. A lot of time just listening also is enough, because let them speak, let them vent out, and don't speak for the sake of speaking, because otherwise you are wasting your energy and also your calmness of mind, because you need to think what next I can do to mitigate the situation. You will see a lot of time they will ask you some questions that have no meaning, that is just to provoke you. So avoid all those kinds of challenging questions. It's always good and helpful to redirect. For example, whatever the issue is, whatever the problem is, take their attention to the issue. For example, if they are, if there's a problem with the machine, so you say, see, there is a problem with the machine. My team is trying to see what best can be done. How can we make sure that your patient gets the investigation done at the earliest possible? So redirect their attention to the issue rather than arguing and just answering their questions. So otherwise, it will just result into kind of a power struggle between you and them. As I said earlier, also, a lot of time they just want to speak. So it's okay to let them vent, especially if you are not in an open place. It's not like corridor or outside OT or inside labor room or inside ICU. If they're sitting in your room, in the counseling room or in your chamber, and if they are saying something, there's no harm to let them vent what they are saying, because a lot of negative energy also going to get released because of it. But if it is happening in a place which is not safe, then of course you can tell them that this is something not acceptable. You can't shout in the OT or ICU or in the labor room. Then whatever behavior they are doing, you can also enforce a reasonable limit. For example, if they are speaking louder, maybe you say, see, if you shout and talk, I would be able to help you. So you need to calm down and talk in a manner the way I'm talking to you. So as I said earlier, also that you can redirect them to the right person or ask them to write their feedback or complain. But if you see the person is becoming completely belligerent, very defensive or disruptive, and is just getting misbehaved, and there's a possibility of the person becoming violent, then it is always good to set limit and tell them that sorry, I will not be able to talk in this manner. So that will very clearly you are setting a limit that this is something not acceptable. And never promise any consequences that you cannot deliver. For example, sometimes you say, if you don't control yourself, I'm going to call police or I will not attend to your patient. Don't give such kind of consequences to the patient or their family members. So at this stage, it is very important to be mindful of your non-verbal expressions, especially your facial expression. So make sure that your facial expressions or your non-verbals are non-threatening, especially when the person is really, out of control. They're not listening to you, but they are watching your non-verbal communication, your facial expression, your eye contact, your body language. So make sure that your body language, which includes your gesture, facial expressions, movement, tone of voice, they are neutral. They are not communicating anger or they are not aggravating the situation. Sometimes these expressions can be very detrimental. For example, when you lift your hand and you say, I don't care what you are saying, I can't help it, I can't do anything about it. That's not my responsibility. That's not my job. So when you give such kind of an expression, you're likely to receive additional aggressive reaction from them. So in such situation, please, avoid overreacting. The only one person you can control is you. So make sure that you remain calm, rational, and professional. If you can manage your behavior, you will see the other person also will start emulating you. So make sure that you remain calm. Usually, you will see an aggressive reaction. Usually, both the parties become aggressive, and that's how situations go out of hand. But if one of the person stays calm and rational, you are able to control the situation, and your response is going to directly affect the person's behavior rather than becoming aggressive. Use assertion. Avoid actions that can actually aggravate the situation. For example, shouting back, banging doors, throwing patients' file, calling security without provocation. So if you do something like this, it's again going to aggravate the situation. So during this whole process, keep an eye on how what you are feeling. You have to be mindful of your feeling. For example, if you think you are getting angry, so there's all possibility within few minutes you will act aggressive, or you are scared. There's a possibility that out of fear you might do something which is not appropriate. So don't ignore your feeling, and if you are upset, let someone else handle the situation. That is stage two. Now, once things have gone out of hand, this is crisis stage three. and crisis stage 3 is acting out. You will see the person may lose control and exhibit aggressive or violent behavior. That's where they may start throwing things, they may start damaging furniture and other items, they may even hit people, and they usually are not in that state where they can use their rational mind or any kind of reasoning. So at that point, there is no idea. It's not helpful to sit and talk to them and counsel them. At that point, the management strategy has to be ensure safety. Make sure that you and those around you are safe, because the patient or the family can start hitting out anybody and everybody. If possible, if you can see danger, if possible, remove other patients and staff from that area. Otherwise, I mean, there's all possibility of them also getting, they can get injured. So, and in this situation, call for help, engage security, activate your emergency procedure. Like, for example, we have a code violate. I'm sure even you may be having the same, code. So, initiate code violate so that everybody gets alerted. Everybody concerned with this situation can come in and control the situation. In this situation, minimize interaction with the patient and their family member, because they are aggressive. At this moment, any effort done by you is not going to immediately resolve the problem. So try to avoid any kind of interaction with them, or any direct confrontation or explanation, or even verbal exchange to de-escalate the situation. Even that's not going to help, because they are not in that listening mode, and their rational mind is completely hijacked at that moment. So let somebody else handle and calm them down. Then comes crisis stage 4, which is tension reduction. That's when they have actually, after a few minutes, when their emotions have gone down, and now they start thinking, what did they do? Where did they overstep? What they could have done? So now they will regain control over their behavior and emotions. They may regret their actions, and they may want to even apologize or compromise. And they look to make amends. How can I, change the situation? How can I apologize? So again, I know usually we are very upset at this situation and we don't feel like talking to them or doing anything. But uh, as a professional, I think the management strategy at this point will be, remember that this is opening an opportunity to positive change, reconnecting and resolving the issue. So at this moment, when you see them regaining their, rationality, offer reassurance. Again, avoid discussing the incident, because again they will start arguing with you and they will start blaming you for what has happened. So avoid that part, but reassess the patient's needs and address those issues and concerns, so that you are able to look after the patient. Whatever has happened, this should be documented, because these documents help us learn from every situation and make us better prepared for the next one. So I'm sure in your hospital also there must be a protocol of writing the incident report. And there are formats available. This is one format I'm sharing with you. There may be many more formats. You can create your own format for incident reporting. So the idea is that it should have details of who was the patient party who became aggressive, and the hospital staff who attended the situation initially. You can also make a mention of the background situation. Why did that happen? And then how did you respond? How did you try to mitigate the situation? And then what was the outcome? What did both parties agree? So what ultimately was agreed between both the parties, and what actually aggravated the situation? What was the trigger? And what is the way to not only solve this problem to and prevent this situation? So kappa is corrective action and preventive action. So what corrective actions can be taken in such situations, and what preventive actions can be taken to avoid such incidents from happening? And then, of course, your name and your contact details, how they can reach you for question or for result. Post crisis stage, it's very important. This is very important actually. It's important to sit and reflect. It's very important to check how you were feeling before the situation, how you were feeling during the situation, and how you are feeling now. And then discuss with your colleagues. You will get a lot of ideas from your colleagues how to identify the situation and mitigate the situation at the earliest. Read material to update because that gives you a lot of ideas, a lot of strategies about how such situations can be managed. And there are a lot of programs, crisis management programs that can be, attended to learn how to handle these situations. So the carry home message that I want to give you is it always storms before it rains. So crisis moments do not happen all of a sudden. There are red flags, there are warning signs, and if you can identify them, train your team, train your people to identify those warning signs and don't ignore them. Rather, intervene at the earliest possible opportunity and mitigate the situation and de-escalate. Thank you. I'm going to stop sharing the presentation. You can have your cameras on if you're comfortable.
Thank you so much, Madam. Um, Madam, sometimes the patients are in our hospital, they are very coming very late and they do not take any appointment. And when the machines are off, and we are telling that we are now closing the OPDs.
Mm.
One day, one of my patient, they tore the file, they fought a lot, and the other day he came back to give me my file, and these what to do with these kinds of patients.
One challenge is, see, if there's a culture of aggression, then for them this is a normal behavior. If you think that's how people react to refusal, or they don't have frustration tolerance, or they can't accept no, and if that's the culture, then you will see this behavior for them is very, very normal. But if you meet them individually and help them see why it is not possible to do, rather than reacting with anger and aggression or ignoring their anger, if you sit and talk to them and make them see why it is not possible, so probably they will understand your point of view. But then, of course, I know there are situations where we are on the receiving end, and if they are in majority and all of them act aggressive, then I'm not sure how you really can, have a fair deal coming from them. It's more like a mob behavior. It's more like a mob behavior. If everybody is aggressive, then you can't help it. But then communicating with them, informing them. For example, if you have done one test, uh, in spite of them coming late, but if you tell them in a very clear manner, see, I have done this time for you, but you need to come at this particular time. Or, for example, if you think people are really coming from very far off place and lot of them are not able to reach during your OPD hours, then best would be to have your OPD hours in such a manner where these people can actually leave home and reach you on time and get the treatment done. For example, if my OPD place is at a place where people will take 3 to 4 hours to even reach me, so naturally, they will never be able to reach between 9 and 12. They will always come between 12 and 2. I need to then consider, should we have some afternoon OPD or evening OPD? That only you can, kind of assess depending upon various factors in your area. But I know there are, even in India, there are places, where the patients are very aggressive. So even if they are wrong, they still are very aggressive and they misbehave. But then if you have good security around you, If you have people to stop and control them, suppose if it is one random case, and if you have proper security, I'm sure they can handle that person. Mob is difficult to handle. And then also sometimes when we can see that this is one odd person who is acting like this, and best other patients are fine, you have to pick your battles. Maybe you will adjust and you will accept his request and you will do it. So it all depends situation to situation.
Mhm. Madam, and you also told if any complication occurs or if any mistake is occurred, so we should clarify to the patient, Madam, nobody will accept that we create complication or we made a mistake. They expect the doctors not to do any kind of mistakes, and we have to hide that.
So although I will be discussing this in great length when we will cover disclosure of medical error. But at the same time, let me tell you, if your pre-procedure counseling is done properly, and if they are informed and explained the possibility of complication or the risk in any procedure. See, we hesitate doing proper pre-surgery counseling because we fear the patient might run away. But then, if we are not doing pre-procedure or pre-surgery counseling, pre-operative counseling, then we are not giving them complete information. So they expected you to give perfect result. You did not clarify that there is a possibility of risk and not everything is under your control, and you are not 100%. You can't guarantee 100% result. Then there is all possibility of them getting aggressive with you because we have not clarified to them. We have not prepared them for that.
Mhm.
Pre-surgical counseling, pre-procedure counseling is very, very important. Let them know that we will do everything. You know, I always say that's a sandwich approach. You explain them that there is a possibility of this complication, but you also tell them that from our side, we will take full care, but then not everything is in our hands. At that moment, how patient's body responds to the treatment, we have no control. But that if we have spent those 15, 20 minutes, half an hour before the procedure, normally we avoid talking about it because we feel we are unnecessary triggering anxiety in the patient or the family. But then, what if that happens? When that happens, and a lot of time I've seen the staff goes and tell them the truth. This complication happened in the OT or in the labor room. The family already knows the fact, and then over and above that, you are trying to cover it up. They are more annoyed with you now. One, you have done harm, and now you are covering it up. We have seen such cases also.
Mhm.
Your communication with the patient has to be very, uh, you know, carefully planned, and you have to invest time in that.
Mhm. Madam, once one of my patients conceived after 8 years of infertility, and while we decided to do cesarean for her, and she was asking, and the attendant were asking repeatedly that how will be the baby held? Will the baby be good? We told yes, we will try our best, and we cannot expect more than that. Then they ran away and they did the cesarean in the other hospital. Although the doctor on the duty talked a lot with them, I talked a lot with them, but they were hesitated about telling that we didn't tell them that the baby will be 100% good, because we were not sure about. So in this case, what to do?
Whatever you say should be based on the data. If you tell them that 8 out of 10 deliveries happen this way, or on the basis of the parameters, the child looks okay because the weight gain is okay, ultrasound report is okay, child heartbeat is fine, growth is as per the gestational period. So when you give them this explanation, they but we all know that during delivery, probably it is the most unpredictable specialty of the medicine. Obstetrics is one of the most unpredictable. You never know what happens, in each case. I've seen patients going into amniotic fluid embolism, fetal death, fetal distress. So this is something, but if we have talked about it, then I think you are on a safer side. You have explained it. Again, that requires investment of time, but it is worth the time. So if they went and got their cesarean done at another place, maybe I can share my own experience. One of my family member, he had to undergo angioplasty. So he went to one of the doctor who was very well known, and we agreed to get the angioplasty done by him. But then he did not answer the questions properly. He did not explain it properly. But still, we still agreed to get the procedure done by him because we checked with others about his capability, and everybody said he's a good cardiologist. We decided to get it done. By chance, we went to another cardiologist for second opinion. But when we went to the second doctor, he really explained everything very, very, patiently. He answered all the questions. He explained everything. Then this relative of mine, immediately after coming out of his chamber, he said, I'm not getting my procedure done by the previous doctor. I want to get the procedure done by him. Again, your counseling, I'm not saying reassure. Don't give any over reassurance. Don't give false reassurance. But give them time. Make them comfortable. Answer their questions. Explain them well. Some basic information you must talk to them. Ask them what questions they have. Those 5-10 minutes investment is a very, very, I can give you n number of examples. I remember one of my relative had to get their histoself-angiography done. So they went to 2-3 gynecologists, but they were not very satisfied. They asked me that, can you refer us to somebody? I knew a friend, I sent them to her. And after going there, they asked a lot of questions. That gynecologist answered it very politely. In the end, the husband of that patient said, sorry, doctor, we have asked you so many questions. You must be really very annoyed with us. He said, no, it's perfectly all right. It's my duty to answer your questions. The very next day, they got the procedure done by him. So we have to see, am I communicating enough? Am I answering their questions? Am I making them comfortable? Am I giving them the information they must get from me?
Thank you so much, madam. Would you share the format of this patient aggressive moments with us?
I will share this YouTube recording with you. So you can watch, your other members can watch. I mean, whoever can get benefit, they'll be happy. That's the agenda. So I will be sharing this recording with you. You can share with your colleagues or whomever you want to share, and you can discuss this.
Yeah. Thank you so much, madam.
Thank
Have a
you.
nice time.
You too.
Bye.
Bye.
Miss, sorry, can you share with us some documents and also this slides that today you share with us?
So as I said, I'm sharing the recording with you. The document is there.
Mhm.
I can share the soft copy of the document also. There is no problem. I will
Thank
send.
you.
I will share the format. I'll give you a couple of samples. You can use whatever works for you.
Mhm. Thank you, Miss.
Okay.
Thank you.
Bye bye. I can close this session.